Hi, nurse practitioner and coach Nicole here to talk to you about Polycystic Ovarian Syndrome, or PCOS. Now, as always, these videos are for information purposes only, not meant to diagnose or treat any one person. PCOS is an umbrella term, which means that there are many different iterations within that diagnosis, and it is the most common metabolic and endocrine disorder in women. So PCOS is thought to be due to genetic predisposition to certain environmental triggers that can lead to menstrual and ovulatory irregularities, low fertility or infertility, a surplus of androgens, which are typically thought of as the male sex hormones in the female, and metabolic dysfunction such as insulin resistance. Now, not all of these need to be present in order for a person to be diagnosed with PCOS. Now let's break down that word, hyperandrogenism. Big word. So hyper means high, and androgens are those male sex hormones, most especially things like testosterone and androsterone. So both men and women have these naturally occurring. Men obviously have higher levels than women, and they're both important to have in a normal, balanced, healthy person, okay, whether you're male or female. It's when these hormones get out of balance that we start to see problems. So in the instance of PCOS, when these androgens, the male sex hormones, get too high, we can start to see symptoms such as hair growth in a male pattern, so like on the face, the chest, and the back. We can see more acne and also loss of hair on the scalp, or alopecia. These are the basis, the key features of PCOS. Now, there are two groups of PCOS. There's obese and then there's skinny PCOS. Now, the obese type of PCOS is generally more associated with the insulin resistance. The skinny PCOS, not so much. So the dietary recommendations for obese PCOS of calorie restriction and carb restriction probably don't apply to skinny PCOS. And in fact, if you try and push that diet on a skinny PCOS, you could actually be making things worse, causing more PCOS symptoms and not less. There'll be another video more on diet. Knowing more about your particular kind of PCOS, the underlying causes, is how you're best going to be able to treat those underlying causes and alleviate your underlying symptoms. Don't settle for just being thrown under birth control and metformin, as these only mask the symptoms. They don't actually treat the underlying cause. Be your own advocate and take charge of your health.